Hi everyone, welcome back again to Smartness and RN YouTube channel, and today we are going to be learning dosage calculations. So dosage calculations is very important in pharmacology exam, in every NCLEX pharmacology exam, school exam, and even as a new grad nurse that has to administer drugs to patients, you might have to do one or two different kind of calculations before administration in order to ascertain the right amount or volume of drug to be administered to that patient. But before we look into dosage calculations, these are very important parts of dosage calculations that I would like us to consider. Firstly, we have the conversions, because there will be different kind of conversions in order to administer drug to a patient or in order to solve a pharmacologist question. And these conversions should be based on either metric table conversions or household system conversions. But for the sake of clarity, most of the times in most of questions that you meet in pharmacology exams, you are mostly going to meet conversion based on the metric table. Then lastly, we're going to look at the method of dosage calculation, which is the main thing that we are here to do today. And there happen to be different methods for solving dosage calculations. We have the basic formula method, which is also called the desired overlap method. Then we have the ratio and proportion method. Thirdly, we have the fractional equation method. And the fractional equation method is the same thing as the ratio and proportion method, just that this time around it is written in forms of fraction instead of a ratio. Then lastly, we have the most common method that people use, a lot of pharmacology students use to solve dosage calculation, which is the dimensional analysis method. There are a lot more methods for solving dosage calculations, but this happens to be the four most common methods that most people use to solve or attempt dosage calculation questions, and even to convert dosage from one dosage to another in a hospital setting, in a clinic setting, aside exam basis. So right now we're going to start from the conversion. And this is a metric table, and it will be very important as a nursing student or a new grad nurse to have this table somewhere at the back of your mind. If possible, you can pause this video to screenshot to get a soft copy of these metric tables. Familiarize yourself with this table, familiarize yourself with the basic conversions from centigram to gram, from ounce to millimeters, from tablespoon to from teaspoon to tablespoon, and all of those things. All right. So most of the times you're going to find out that in a particular drug package, you have, for example, one tablet consisting of 20 milligram per tablet. For example, this is a nifedipine tablet, and for every tablet here, it makes up 20 milligrams. So meaning one tablet contains what, nifedipine 20 milligrams. But how about if a doctor prescribed a drug for this patient that would need to be placed on this medication, instead of he to write that prescription in milligram, you can see something like administer 0.4 gram of nifedipine. So how do you convert? Remember, there's one thing I want you to note when it comes to conversion. You are converting to the metric unit on the drug package. You are converting to the metric unit on the drug that is available. So now we're going to be looking at the different methods for solving dosage calculations. And of course, we'll be starting with the basic formula method, which is one of the most used methods, okay? Although dimensional analysis happens to be the most common and most adapted by a lot of nurses worldwide, but we're going to be starting with the basic formula method, and from there we'll move into other methods. Right here on your screen is an extension of the basic formula method, where we are going to talk about how to solve questions using this method. So one thing you need to know is that this basic formula method is also known as the desired over half method. Now you want to ask, what does the desired over half method mean? And that's where we come here. This means that the drug desired all over the drug we have times the vehicle or the drug form. By vehicle, we mean, is this drug in a tablet form, a capsule form? Is it in a syrup form? Which is going to give us our finality. And our finality, which happens to be the amount that we get. Meaning the question, from the question, we would know what exactly are we looking for. And whatsoever we are looking for gives us the finality. So think of the amount as the answer to our question. So how do we make use of these things to solve a question? So let's come back to my nifedipine example. So this is once again my nifedipine pack. And from this nifedipine pack, you can see that we have what? 20 milligram, that each tablet consists of 20 milligram. Now, if each tablet consists of 20 milligram of nifedipine, it means that what we have is 20 milligram. I just want to give you an example, okay? So it means that we have what? 20 milligram. 20 milligram is what the drug we have. So what about the drug we desire? For the drug we desire is what was prescribed for these patients. Now, if one tablet of nifedipine contains 20 milligram, what exactly was prescribed? So most of the times, what is prescribed could be in the same metric unit or it could not be. But first of all, we're going to solve for this one that is in the same metric unit so we don't have to do any conversion. So let's say what was administered or what was prescribed for this patient was 40 milligram of nifedipine. So what was prescribed becomes what we desire. For the desired, we're going to be looking for at the prescription to find out the desired. Then times the vehicle. So how do we know the vehicle? Of course, you can see here that this is a tablet. So because this is a tablet, we know that what one tablet contains nifedipine for 20 milligram. So I'm going to multiply it by what? One tablet. What is that going to give us? It's going to give us our answer. So when we do an answer, when we solve for answer, milligram would cancel out milligram, 20 would give us 2. Or you can bring it out here and say what 40 all over 20 times 1. When you do 40 all over 20 times 1, you are going to get what? 2. It means that what are we giving this patient? 2 tablets of nifedipine, which is accurate. Okay, if 1 milligram is in 1 tablet, it means that for us to get 40 milligram, we are going to be administering 2 tablets. Now let's solve for a different occasion where we have to do some metric unit conversions. Let's say that in this scenario, what was prescribed for this patient was what 0.1 gram of nifedipine. Okay, and what I have available is that for 1 tablet, it contains what this is what the drug desired. Now, what do we have? We already know that for 1 tablet contains 20 milligram of nifedipine. So I have what 20 milligram of nifedipine. This is the drug what have. Well, we cannot use 0.1 gram to cancel out 20 milligram if they are not in the same metric conversions. So the first thing you would want to do is to convert before solving, because there's one thing you need to note about the desired over half method is that what the measurements must be same. Now, if the measurements are same, then you can already begin to solve. But if the measurements are not same, then you cannot cancel out, because gram cannot cancel out milligram because they are not in the same metric unit. So we are going to convert. Now, from what we said already, how do we do this conversion? We already know that we are converting to whatsoever it is that we have available in the drug pack. So all your conversions is done into what we have available, meaning that we are going to be converting gram to milligram. Okay, so we already know that what 1000 milligram would make what 1 gram. Okay, and now what are we trying to convert to? We're trying to get milligram. Okay, but we're trying to find out what 0.1 gram would give us a milligram. So we have what 0.1 gram here, and we have x because we're looking for milligram. So when we cross multiply, we're going to have what x will then become 1000 times 0.1. When you times 1000 times 0.1, we'll have what 100. Okay, that will give us what 100 milligrams. So what that means is for 0.1 milligram, for 0.1 gram becomes what 100 milligram. Now that our units are already in the same metric measurements, okay, so now we're going to impute our digits. So the drug desired was 100 milligram all over the drug we have, which is 20 milligram in every nifedipine tablet times 1 tab give us our amount. So we cancel milligram with milligram. We have 20 here 1, 20 here 5. Or you can bring it out and say 100 divided by 20 times 1, which will give us 120 will give you 5 times 1, which is equals to 5 tablets. So we're going to use this formula to attempt 1 NCLEX clinical case questions before we move into the next formula. So for this question, we have that if doxycycline hyclate medication was administered for a female patient at the medical ward. And in this prescription, it was written that this drug is to be administered per orally. For the initial dose, she is to be given 200 milligram and then 50 milligram BID. And of course, according to our medical abbreviations, we already know what BID means twice a day. Okay, so the question here says, how many score tablets would you give as the initial dose? And the second question says, how many score tablets would you give for each dose after the initial dose? And already On your screen, you can see the drug form. You can see a photo of this drug packet. So from this drug package, we can easily see what drug form is available and what we have, okay, before we begin to solve to get our amount. All right, so let's attempt this question right now. The first thing you want to do is to bring out your figures from the question. I usually advise a lot of pharmacology students or a lot of nursing students that are currently studying for pharmacology exams that one of the easiest way you are going to tackle these questions is to easily bring it out. It's very important for you to bring your figures out. Okay, so I brought these figures out and I have desired. We have 200 milligrams to be administered initially, and finally we have 50 milligrams to be given twice a day. Then what do we already have from our drug capsule, from our drug package? We already saw that we had 100 milligram and the vehicle was in one tablet. All right, so let's bring this back into the way we solve for this question. So we're going to initially solve for the drug dose we would administer initially. Okay, so for initially we are to administer 200 milligram of that doxycycline hydrate drug. And what do we have? We have 100 milligram, then times 1 is going to give us what? 200 divided by 100, which is what? 2 tablets. Remember that this one here meant 1 tablet, okay? So we have what? That this patient is supposed to be administered 2 tablets for the initial dose, okay? Then how about after the initial dose? How many are we going to be administered? It's very simple. We're just going to come here and erase the 200 and make it what? 50 milligram. So milligram will obviously still cancel milligram. Then we're going to have 50 divided by 100, which is going to give you 1 all over 2 tablet. But remember that this drug is to be administered twice daily. So meaning what? If I'm to administer 1 over 2 tablets, which is half tablet per dose, how many am I supposed to administer daily? I'm going to have what? 1 all over 2 plus 1 all over 2, which is going to give you 1 tablet. So that means that for the initial dose, this patient will be administered 2 tablets, and for the rest of the occasions is going to be what? 1 tablet in divided doses. Okay, so now we're going to move to the next formula for solving dosage calculations, which is going to be the ratio and proportion method. This is the ratio and proportion method. So I want you to notice something from the formula. You can see that we still have the basic things that we saw at the basic formula method. So H here still means have, the drug we have, then V remains our vehicle, then D remains our drug desired, and finally X represents our amount. So it's still the same amount we had over there. So we are looking for X is what we are looking for. The same way when we were at basic formula method, we were looking for X. So it's the same thing that's happening here, okay? So over here, I want you to take note of something. So we have that H ratio V. How do you want to put this to memory? Just think of HIV. Remember, if I have HIV, okay, and just imagine the I in between becoming the ratio. That's what H ratio V. Then the remaining things we have, which is the drug desired, will be ratioed to the X, okay, which is our amount. But if you look at this, what we are simply having here is that H ratio V is equals to D ratio X, meaning that what the drug we have ratio the vehicle is equals to the drug we desire ratio the amount, okay? So we already know this, but how do we multiply this in order to get our answer? It's very simple. So we are going to multiply the ones inside, we multiply the vehicle with the desired, then multiply what? The drug we have with what? The drug, the finality that we are looking for, which is the final amount we're looking for. So, which is also what? Same thing as what? Multiplying the means and multiplying the extreme in order for you to answer. But just like basic formula, in this particular one, we also need the units to match, and we also need the order to match. Now we're going to understand what we mean by this once we dig into this question. So we'll use this formula to solve the very first sample question, and after that we'll take one NCLEX clinical case question and also use this ratio and proportion to solve for it. Okay, so this is a folic acid tablet medication, and we can see here, according to the drug labels on this package, we can see that for one tablet contains was 5 milligrams of folic acid. 2.5 milligrams of folic acid was prescribed for these patients, and obviously we have to impute our figures for us to begin to solve. Okay, so the order for this patient, the order says what? Give what? 2.5 milligram for folic acid. Okay, so let's impute the things that we need. What do we have? The drug we have is obviously the drug we have on ground, and obviously you can see what we have here is 5 milligram of folic acid. So what we have is what? 5 milligram of folic acid. Now the next thing is the vehicle. Now, for this 5 milligram of folic acid is for what? One tablet. Of course, you can see here that we have what? 100 tablets here. So 5 milligram, the vehicle is what? Tablets. Because for every 5 milligram is contained in one tablet. So for vehicle would come here and write one tablet. Then how about what? The desired. The desired is obviously what was ordered for this patient. So for desired, we'll have what? 2.5 milligram. And finally, the X, which is what we are looking for. Okay, now let's impute this. When we are imputing this, we have what? 5 ratio 1 is equal to 2.5 ratio X. Now remember how we say we do the multiplication? We multiply the means, so, and we also multiply the extreme, which will give us what? 2.5 will give us what? 5X. Then therefore, X will be equals to what? 2.5 divided by 5, which when we multiply it, we'll have what? 1 all over 2 or 0.5, meaning that this patient would finally be administered what? Half of one tablet. Now we're going to look at one NCLEX clinical case question and see how we are going to use this ratio and proportion formula to solve the question. So the question says that a physician writes an order to administer an oral medication, and the order says administer 0.1 gram by mouth once daily. The pharmacy dispenses you with 100 milligram per tablet. How many tablets do you administer per dose? Now remember how we discussed that the first thing you need to do when you're solving these questions is to bring out your figures. So we're going to bring out the figures now. The first thing I want you to note in this question is to note that our order and units are not in the same measurement, okay? And we want them to be in the same measurement. According to what we described the last time, how do we do our conversion? We have to convert to what we have available. Now, since milligram is what we have available, it means that we're converting from gram to milligram. Now, conversion says 1 gram is equals to 1,000 milligram. Therefore, 0.1 gram will be equals to X. When we cross multiply, we would have 1,000 times 0.1 is equals to X. So our X would therefore become 100 milligram. Okay, so instead of 0.1 gram, we are going to be solving with our 100 milligram. So when we impute our figures, we have H ratio V is equal to D ratio X. So what do we have? We have 100 milligram ratio. Our vehicle says 1 is equal to what's our drug desired? 100 milligram ratio. What are we looking for? We're looking for X. So when we multiply means versus extreme, we'll have 100 is equals to 100X. Okay, so when we want to solve for X, X would therefore be equal to 100 milligram all over 100 milligram. So having said that, the answer becomes 1. So how many tablets are we going to administer per dose? The answer is 1 tablet. The next method we're going to be looking at is using the fractional equation method. One thing I want you to note about the fractional equation method is that the fractional equation method is the same thing as the ratio and proportion method, but this time around, instead of it to be written in a ratio form, it is written in a fractional form. Okay, so we just talked about ratio and proportion method where we say H ratio V will be equals to what? D ratio X. So what does that mean? It means that for fractional equation method, it becomes what? H all over V is equals to D all over X. Very simple, right? Very simple. Well, our H remains our drug we have, V remains our vehicle, D remains the drug desired, and finally X is what we are looking for, which is the amount. Okay, so this question says that a patient was ordered erythromycin tablets 0.5 gram to be administered per orally Q8H. And I hope you know what that Q8H means. It means 8 hourly. So this medication was given 8 hourly. And our question says, and the drug packet is given to us, as we can see the drug packet here. But the question here says, how many milligram should the patient receive per dose? And the second question is, how many milligram should the patient receive per day? And the third question is, how many tablets should the patient receive per dose? Okay, so the first thing we want to do is to impute our figures to be able to get what we need. The drug we have from the example was 250 milligram per tablet, which is the vehicle, and the drug we desired, which was the prescription, was 0.5 gram. And obviously we have what we are looking for. First thing we are looking for is how many milligram per dose. The other thing we are looking for is how many tablets per dose. And finally, we want to know how many milligram per day. Okay? So when we look at all of this, remember that this drug was given Q8 hourly. It means that this drug was given 8 hourly. So the first thing we're going to solve for, let's first of all solve for how many tablets per dose. So let's impute what we already have here. Remind you, we cannot impute what we already have here if we do not make these measurements to be in the same units. They are not in the same metric units. So let's solve for that. Remember that we are converting to the drug we have. Okay, so we are converting from gram to milligram. So let's do that. We'll have if 1 gram is equals to 1000 milligram, what that means is that 0.5 gram is equal to X. So X becomes 1000 times 0.5, and X becomes 500 milligram. Okay, so it means that 0.5 gram is equal to 500 milligram. So it's time for us to begin to solve our question. It means that wherever we're supposed to use 0.5 milligram, 0.5 gram, we are now going to use 500 milligram. Computing for this question, we have the drug we have is 250 milligram all over the vehicle, which is 1 tab, is equal to the drug we desire, okay, which is 500 milligram all over finally X, the tablet we are looking for. All right, so what do we have? We have 500 milligram tab is equal to 250 milligram X. Milligram cancel milligram, cancel milligram. We have 500 tab is equal to 250x. We want to look for x, so x becomes subject of formula. So it means that x will be equals to 500 tab all over 200 and what? It means that we're going to do 500 tab all over 250. So 250 divided by 500 is going to give you 2 tablets. Okay, so the tablet we are going to administer per dose is 2 tablets. Now, if 2 tablets is what we'll be administering per dose, how many milligram would we administer per dose? We already know that for every 1 tablet contained, according to the drug we have, 1 tablet contains 250 milligrams. So it means that 2 tablets will be equals to what? 250 times 2, which is equals to 500 milligrams. So the milligram we are going to be administering per dose is equal to 500 milligrams. Now, finally, we would solve for how many milligram would we administer per day. Okay? So in one day, we have 24 hours. Okay? So 24 hours divided by this drug that is to be administered 8 hourly. All over 8 hours, we're going to have what? 3. Okay? So it means that the milligram we're going to be giving per day, if I am going to give 500 milligram per dose, 500 milligram is to be given in 1 dose. And this drug is to be administered 3 times daily, because it's administered on an interval of 8 hourly. So it's going to give us what? 500 times 3. So it means that in a full day, this drug will be administered in 1,500 milligrams. All right? Yeah. So that brings us to the end of this example using our fractional equation. And now we are going to look at how to solve using dimensional analysis. And dimensional analysis, which happens to be the most common, the most used method of dosage calculations. And dimensional analysis method is one of the best methods. The only advantage that I personally see the dimensional analysis method is that there is no need for separate conversion. So even when we have conversions to be done in a particular question, we don't have to convert separately. Like everything is set up as one equation. So we're going to, first of all, I'll try out some questions without conversion before we finally look at some questions where we need to convert from one metric unit to another. We'll be looking at the question where we don't have to convert anything, but I want us to first of all pay attention to the formula. Okay, so for conversion, we have vehicle over half times desired over 1. Just know this, for fractional analysis, we'll mostly always start off with the vehicle. So vehicle all over what we have times the desired dosage all over 1. There are some steps that we use to solve for the fractional analysis method. The first step is to identify the unit and the dose. Okay, now for the dose, I am talking about the known dose. And by known dose, I mean the drug we have. Okay, so you first of all identify the unit and the drug we have. Okay, more like saying you're identifying the vehicle and the drug we have. Okay, so that's the first thing you would identify. Then the second thing is that you have to always bear in mind that the denominator must match the next numerator. Okay, in case it doesn't make sense, just listen, we'll be doing that now. Then we have that if the conversion is needed, you are supposed to add the metrics into the equation. Remember that we say that for fractional analysis, we don't solve conversions separately. Everything is brought into and set up as one equation. Then lastly, we have cancelling out. This question here says that we have amoxicillin that was ordered for this patient, 0.5 grams to be given per orally, 8 hourly. And what we have available is 1 capsule of amoxicillin. According to the drug label, what we have available is 1 capsule of amoxicillin containing 250 milligrams. You can see here that the order, which is the drug desired, is not in the same measurement unit as the drug available. So conversions is needed. But just like we said, for fractional analysis, we don't have to separate the conversion. So how are we going to do it? This is how we're going to do it. We are going to impute the conversion into the equation. Okay? Here we have that the drug vehicle over the drug we have times multiplied by the conversion for the drug we have all over the conversion for the drug we desire times the desired over 1. But you don't want to stress yourself with all of this information, okay? So let's just look into it. The first thing we want to know is, what do we have? What is the vehicle? The vehicle was in 1 capsule. So we have 1 capsule all over. The drug we have was in 250 milligrams. But because this is in gram, we want the units to be the same. We are going to impute the conversion into the equation. We know that what 1,000 milligram will give us 1 gram. So we're going to come here and say times 1,000 milligram all over 1 gram. Why did I take milligram up instead of down? Because I want it to be in such a way that the numerator will cancel out the denominator. Okay, so we will continue with the things we already have times the drug we desire 0.5 gram. I say this makes sense because gram will finally cancel out gram. Okay, then finally times 1. So since what we're looking for is the drug to be administered per dose, you can see that our 8 hourly was not even needed. It was just a distraction. Okay, because it's only if we were asked how much drug are we to administer in a day, so we'll bring in the 8 hourly. But since we're looking for the amount of drug to be administered in a dose, so 8 hourly is not needed. Okay, so milligram will cancel milligram, gram will cancel gram. So what do we have? We have 1 cap times 1,000 times 0.5 all over what 250 times 1. When we times that, we'll have what 500 cap all over 250, which is going to give us 2 capsules. Okay, so for solving with dimensional analysis, just have in mind that the first thing you want to do is to identify the vehicle and the known dose. Okay, the unit of the vehicle unit, and the known dose. Then just make it in such a way that every numerator must cancel out the denominator. So if you already have 1,001 gram written down here, and let's say we have one capsule, just know that whatsoever thing you are doing, the numerator must have gram so that we can be able to cancel out the previous gram that we already had. All right. So now we're going to be looking at solving an NCLEX clinical case question using the dimensional analysis method. For this question, we can see that a drug order was written for this patient, which is the lorazepam oral suspension. And in the prescription, it was written that the patient is to be administered 0.4 gram per orally for 12 hours for 10 days. And in the drug label we have available, we can see that we have 200 milligram per 5 ml available for the drug label. How many millimeters should the patient receive? So the first thing we want to do is to put out our figure so we can know what exactly we are working with. The drug that was ordered was 0.4 gram per orally to be given for 12 hours in 10 days. 12 hourly in 10 days. And the drug we have on the drug label says that it was lorazepam for 200 milligram per 5 ml. And what we are looking for is the milliliters per day. Just like I said, the first thing you want to always look out for when we're using dimensional analysis is the vehicle. Okay, so we have 5 ml for the vehicle all over. The drug we have was given in 200 milligram. Okay, considering the fact that we have a gram question, a gram unit here, which is the drug that we ordered, was ordered in 0.4 gram. So what that means is that we are going to add in our conversion. We know that 1,000 milligram will make up 1 gram. So we're going to do times 1,000 milligram all over what? 1 gram. Okay, then finally times what? 0.4 gram. Okay, all over what? 1. Okay, so when we want to solve this, we're going to finally solve this to know the amount of meal we will give per dose. First of all, before we talk about 8 hours, 12 hourly, and 10 days. So milligram will cancel milligram, gram will cancel gram. We'll have what? 5 mil times 1,000 times 0.4 all over what? 200 times 1. Okay, so we have what? 5,000 times 0.4 is going to give us 2,000. Okay, 2,000 mil all over 200, right? Will give us what? Our final answer when we have 2,000 divided by 200 will be equals to 10 mil. So per dose, this patient will be receiving 10 mil per dose. But how about in a day? In a day, this patient will now be receiving what? According to this drug was administered for 10 days. So first of all, do it by 2 hourly. If 10 mil is given per dose, we have to first of all find out how many will be given in a day before we find out how many will be given in 10 days, right? So for in a day, 1 day is equal to 24 hours, right? So that will give us 24 hours divided by 12 hours, which is equals towards 2 times daily, okay? So if this drug is administered 2 times daily, it means that in a day, the drug is administered what? 20 mil. Over 2 times a day is administered 20 mil. So we have 20 mil per day. So how many is finally administered? How many milliliters is finally administered? Will now be equal to, if in 1 day, 20 mil is administered, then in 10 days, what do we have? We have what? X. So X will be equal to 10 times 20. So the final amount of drug administered will give us 200 milliliters. That is the total amount of drug that is administered. All right, so we've come to the end of this session. Today we looked at the 4 basic methods of dosage calculations. We started with the basic formula method. We looked at the fractional equational method. We looked at the ratio and proportion, and finally the dimensional analysis. Thank you very much for watching today. Please like, subscribe, and share to other nursing students or other new grad nurses that would find this dosage calculation video beneficial. Thank you.